Hello, my name is Hugh Moran and I'd like to present my research poster. My research is entitled An Audit of Adherence to Health Service Executive Guidelines in Healthcare Record Management, and it was supervised by Professor Adrian Murphy. Many healthcare records are currently handwritten, and legible concise healthcare records are essential for patient care. The Irish Medical Safety Network identifies handwriting, communication and spelling as factors contributing to clinical errors. Previous audits have been subjective opinion-based measures rather than implementing a reproducible criteria-based measure, which I will do with my audit. The guidelines I'm auditing refer to 3 points: whether all clinical documentation was clear and legible, when prescribing medications if the writing was in lowercase text or small block capitals, and if all writing on clinical notes was in permanent black ink. My aim was to audit the adherence of emergency department clinical staff to healthcare service executive standards and recommended practices for healthcare record management, to identify factors associated with poor healthcare record management. We conducted a retrospective chart review using a Likert scale designed in line with other validated scales. Legibility was graded using 5 characteristics: letter formation, letter spacing, word spacing, line alignment, and corrections. Individual note entries were also graded for the legibility in addition to the overall chart score. My results found that adherence to the guideline was 0%. The main reason was a lack of small block capitals or lowercase text. Legibility accounted for 9% of non-adherence and black ink only 1%. We graphed the overall chart legibility and found that the minimum was 0.6 and the max was 1, the average was 0.77, the mean was 0.78, the interquartile range was 0.06 and the range was 0.4. Acceptable legibility had been set at 0.7 or 70% and was found to be 9% of charts were found to be legible. When we look at the individual characteristics of legibility of all individual note entries, we find that letter formation has the largest standard deviation of 0.83. It also has the lowest median and lowest average. If we look at legibility in the most legible notes, which is over 90%, of which there were 16, letter formation is second highest standard deviation of 0.57, with the lowest median and lowest average. If we look at legibility of the least legible charts, less than 70%, of which there were 24, letter formation has the smallest standard deviation, and it also has the smallest median and the smallest average. So in conclusion, HSE guidelines are not being followed. Note entries appear to be in normal handwriting. Black ink is almost universal. Poor legibility when set at less than 70% was implicated in 9% of non-adherence. Letter formation is the most variable characteristic overall. It's the least variable in least legible notes, and the second most variable in the most legible notes. Improvement to letter formation would have the single largest effect on overall legibility. Thank you.